health information systems are not routinely part of the learning competencies for medical school graduates.
Good day, everyone, and welcome to the 20th session of UPM Manila SILab webinar series IOL 2025. Now to present openIMS, or the Open Source Insurance Management Information System in Medical Education, Interoperability Principles, Practical Uses and Limitations. I virtually present to you Dr. Julius Migriño.
Thank you to UP SILab for inviting me to share this talk with you. So, the webinar is entitled openIMIS or openIMIS in Medical Education. So in this webinar, I hope to share with you the journey, experiences, and of course the practical lessons learned in introducing, testing, and using openIMIS in a Doctor of Medicine program in an academic setting. Digital health has greatly expanded during COVID, but there is still a need for a more coherent plan, and that the Philippines has been lacking the strong data governance required. Now, openIMIS is the first open source health information technology for the linking of beneficiary, provider, and payer data. It is currently being implemented in multiple countries, including Nigeria, Tanzania, Nepal, and Bangladesh, and is currently establishing a community of practice for openIMIS users here in Southeast Asia. Now, openIMIS has three core functions. You have client enrollment, health claims entry, and health claims management, including feedback, reporting, etc. And all in the backdrop of continuous feedback, monitoring, and of course, reporting. openIMIS is also modular in nature and thus have a high degree of customizability for each use case. Now, openHIE has three architectural layers. openIMIS functions in layer 1 through its many administrative functions such as health facility and health services registries, and it also functions well in layer 3 through its client enrollment and health claims submissions functions. How does it fit with layer 2 of the openHIE framework? openIMIS follows well-established interoperability standards such as those of openHIE in order to be interoperable with several digital public goods operating across the global healthcare sector. So openIMIS is a core digital platform that Nepal uses to manage its national health insurance scheme since 2016. Going into a more localized setting, San Beda University College of Medicine collaborated with AHIN to include San Beda University as part of the openIMIS Regional Community of Practice way back in the good old days of 2020, so January 2020, before the event happened. The students of the Tropical Medicine course participated in the Swiss Tropical and Public Health Institute openIMIS e-learning course, which was supplemented by the 2022 version of the manual openIMIS training program for medical students in the Philippines. Now, the results of the 2022 openIMIS feedback was used as the framework in the incorporation of openIMIS in medical education project last year, October 2024. Health information systems are not routinely part of the learning competencies for medical school graduates. Medical schools who wants to teach health information systems, including topics like openIMIS, interoperability standards, they really need to incorporate these topics under more mainstream courses. And we tried to use localized scenarios that are applicable to general practitioners in the Philippines. Of course, medical students eventually will become general practitioners. So at the very least, they were introduced on what are the experiences of using a health information system such as openIMIS, particularly as enrollment officers, claims administrators, and claims reviewers. So the involvement and the mindset of actually working with the health insurance organizations is very crucial, because working with insurance systems is again not part of the medical curriculum, at least explicitly. Now, phase 2 of the project started with a short introductory webinar presentation on health information systems and the key features of openIMIS as a health information system. Now, this was particularly important because a lot of our medical students were really not versed with health informatics, health information systems. Now, the webinar was immediately followed by a hands-on practical demonstration activity using the live openIMIS demo server. So the medical students were allowed to tinker at least with the openIMIS demo server. So after that, we allowed the students to rate openIMIS in terms of its usability. openIMIS might not be the best in terms of usability, it's definitely not the worst in terms of usability. Now, the chart on screen summarizes the evaluation of openIMIS in the context of current medical education and practice in the Philippines. Now, notable results are highlighted in yellow. While openIMIS was found by medical students to be easy to use, they noted that users needed to learn a lot of things before they can use the system. only about 50% of LGUs in the country have allocated budgets for such systems. Just my guess that one of these reasons is a miscalculation of the resources needed to fully operationalize these systems, which should include technical support and operational and maintenance costs. What is also important for medical academic institutions is training for such coding and classification systems. Not necessarily the FIRE architecture, but also coding classification systems such as ICD. Reliable and portable electronic health records rely on the knowledge of ICD coding from healthcare providers who interface directly with EHR. At least theoretically, they should be interfacing directly with EHRs. So moving forward, there needs to be a special leverage on the actual knowledge sharing, real-life usage of health information systems. It shows a lack of focus given to the usage of important components of the e-health strategy and framework, which includes interoperability, but also includes health informatics, health information systems in general. Now, even if software applications have the best architecture, top-notch technology, and world-class interoperability systems, if the front-end users will not use them, they will just be proverbial paperweights. Front-end users need to be included more in the conversation of the design of these technologies. We should all contribute to the strategy by making sure that the new breed of health professionals understand, but not just understand, eventually use these systems. If you get to maximize the adoption of these technologies through early education, user satisfaction monitoring, user-centric design, it would help and, of course, greatly contribute to the success of the country's e-health agenda and, of course, fulfillment of the ever-fleeting, hopefully we get to achieve universal healthcare.
Okay, that brings us to the end of today's session of IOL 101, openIMIS in Medical Education. Thank you to our dearest speaker and thank you to everyone who contributed. Magandang gabi, hasta magandang umaga. Paalam!